Hi guys, good morning. Welcome back to my my podcast channel. My name is Adubi Okoye and I'm a Nigerian. I'm a nurse currently residing in the UK. So today we'll be talking about a very sensitive issue. A lot of people are ignorant of this topic, and I decided to talk about it because of a question someone asked on WhatsApp. And it's about end of life care. This is a practice I learned here in my place of work, and I would like to share it to my listeners and also to the world because I believe it's going to help improve life and the way we relate with people. I just want to appreciate my place of work, my workplace, Northern Lincolnshire and Go NHS Foundation Trust for this opportunity because I learned this here. So I believe it's going to help people that are caring for their loved ones who are dying, who are critically ill and dying. All right, end of life care is a term used to describe the support and medical care given during the time surrounding death. So it's not a care given at the point of death; it's a care given at the time surrounding death. Like at that point or that period, someone is sick, someone is critically ill. Maybe the doctors have said that, oh, there's nothing else we can do, you know. So it's the care that you give to this person before death, the period that he's still living before his breathing ceases or the heart stops beating. Most times it could be people that are handicapped, like they're not capable of taking care of themselves anymore. They're not capable of doing things that independently they would have done without your help. So that's what end of life care is about. And this does not pertain to it's to age. It can happen to anyone, but mostly it occurs in older people because they have all these chronic diseases. It's more significant in older people because of the chronic diseases. May live with it for days, for weeks, and even months before dying. So the aim here is that you are trying to lead this person to a peaceful death. That's what end of life care is. You're trying to lead the person to a peaceful death. And note that this care can be given at the hospital and also at home. I'll give my reasons for that. All right. So we know that, especially in countries or developing countries where healthcare is not free and then we have some financial constraints. So a lot of people are being ignored and neglected during sickness because of these reasons I mentioned. And maybe they're not looking clean or appealing to the eyes because of maybe they can't afford to do that. So they're just being neglected or ignored until they die. So, but however, in the developed countries, there's already most of them have free health care. So there is this policy already down for end of life care. So this episode is just to clarify that there are different ways of showing care to people, like someone that is sick and dying. It could be through financial means, but especially through kindness. This is very important. If you don't have the money to give someone, show kindness, show empathy. So this person that is dying, to enable the dying person, the critically ill person, pass away calmly and peacefully. And also, you that is taking care of this person, or you that is aware about this person, you would dismay any feeling of guilt or regret, which usually comes after death. I'm gonna give people that be like, oh, I would have done this, I would have done this. There's always regret here, but it could help to dismay the feeling, like because you did what you are supposed to do. So it gives you this closure that yeah, you will miss this person. No one wants to lose a loved one, but you miss this person, but then you did what you're supposed to do. and you have that feeling that you're glad that this person passed away peacefully without being in pain. It's very important aspect because we don't even know where this person is going to. We don't know what he or she experienced or is experiencing at that point of sickness and dying. So it's very important that we give the care we should give when one is dying. So end of life care may be different depending on knowledge. People that are aware of it. That's why I'm making this podcast so that you'll be aware that it's not just about taking to the hospital. I mean, we just kind of have to deal with what we have at hand and try to treat our loved ones with care. So even if you don't have the financial strength to go to the hospital, you can still be at home and show kindness to this person. So it depends on knowledge, accessibility to healthcare. So I'm just referring to Africa now. I know that in Nigeria we don't have free healthcare. So imagine we had free healthcare. So this care will be given mostly at the hospital because the health professionals already know what they're supposed to do. Like I said, in developed countries like here, they already have a policy here for it. So it also depends on financial capacity. If you have the financial strength, you can take your person to the hospital. But if you don't have the financial care, oh, it's unfortunate, but you can just be at home and do the much you can do for this person. The point here is for the person dying to be peaceful while dying, knowing that the loved ones were there for him or her, that they showed care, that they showed concern, and they won't die in agony, in grief, in pain, because they know they were loved, they were cared for. So it also depends on the person's preference. I would give an instance. Preference needs choices. Some people, why dying, even people that are financially capable, they'll tell you, I don't want to die in the hospital. Just take me home. So this is end of life care. Like people make a choice where they want to die. Some prefer to die at the hospital, some prefer to die at home. So it depends on the case you have at hand. That's why I said it depends. They are different depending on knowledge, accessibility to healthcare, financial capacity, the dying person's preferences, needs or choice. But I know that in Africa, especially in Nigeria, what we see mostly is that it's not like people don't want to go to the hospital, but most times they don't have the money to do that. And they die in their homes. But why I'm making this podcast now is that it's unfortunate, like I said earlier, that we don't have the financial capacity and the facilities, or because of the state of the country we are developing. But the point is, show kindness to that person that is dying. The care that the person is receiving at home is very important while the person is dying. So that's where empathy and kindness comes in. Do the much you can do as a human being to lead this person to a peaceful death. So there are actions necessary to put in place, notwithstanding the financial capacity, to help this dying person to a peaceful death. By respecting their wishes, you can discuss with them what do they like, what do they wish for. You treat them with respect and dignity and lead them to that death. All right. So also bear it in mind that the person you're dealing with could be dependent or independent. Like if it's a dependent is able to talk, tell you what he likes, what he would like to do, and what he wishes. Because I know some people say, "Oh, when I die, just bury me here, bury me in this part of the compound." But then if you're dealing with an independent person, sorry, if you're dealing with a dependent person, what I said earlier is for an independent person, someone that is critically ill, knows he's dying, but then is able to do some things for himself. But then a dependent person is someone that depends on you for care, for everything. So while we're dealing with this kind of people, especially the dependent ones, people that depend on us, are looking at some aspects like three things. You're looking at making the person comfortable. That's physical comfort. Pain is alleviating pain is very important when handling end of life, patience. So because you want to make this person comfortable. So someone that is in pain may be angry, even if the person may not be able to voice it out. You may see it on the person's face. She may be frowning, she's not happy, and it even makes it very difficult for the family to communicate with the person. So if there's a prescribed pain medication for this person, ensure you give that pain medication to just take away that pain. All right, and it will help you to communicate very well with this person. Then another important thing is taking care of the patient's skin. So imagine that you have someone that is peeing and pooing on himself. It's important you clean up all those mess, because if you allow it on the skin, it's going to damage the skin. And believe me, someone that is independent would not allow such on her body or on his body. So imagine doing it. He knows he can't do it. Imagine doing it for him. The gratitude will be there. He may not voice it out. You may see some of them smile. They are grateful for your help. So you're trying to make them happy. So you ensure the skin is intact. Like, I mean, just cleaning the skin. You can wear diapers. If you don't have diapers, just ensure that the skin is dry at every time. And you also change the person's position, because someone that is bed bound, like someone that is always lying down in bed or sitting down, if you don't change the position, there's pressure on that area of skin which can cause damage. But by the time you check, you see that there's already discoloration, there's no blood flow, and it will start causing damage to that part of the skin. So it's just taking care of them physically, making them comfortable, relieving pain or alleviating pain, and then taking care of their skin. Things that you know that independently they can do on their own. You're just trying to give them that dependence. You're trying to give them that independence. Independence, you're giving it to them in as much as you know that they can't do it. You're trying to help them achieve what they could do if they had the capacity to do it. So the next point is managing their mental and emotional needs. A dying person could be anxious and depression. Nobody wants to die. But then life happens and some things you cannot help. So you're trying to make them comfortable. You're trying to alleviate that anxiety. You're trying to make them relaxed. You're trying to make them feel happy. So in this case, you can invite their family and friends to talk to the person. Always be around the person. Don't run away from the person. Invite family and friends, talk about them, hold their hands, smile to them, tell them how important they are, how they are loved. If the person wants to speak to a particular person and he or she is not around, they can send a voice note, just record something, let him hear her voice, like let the voice of that person be heard. Listen to them. Most of them want to talk about their life regrets, what they could have done better. Just encourage them. Always smile. It helps to release that anxiety or depression. Play music if you have to, not loud, but just soft and comfortable music. Make them comfortable in their last days. You can tell them stories. You can ask what they wish from their face. So for those that cannot talk, you can, when you do something, they may make they're able to make faces. So you see if they're comfortable with this or if they're not. And if they smile, you see that they're smiling. They hear you. Even for the unconscious patients, they hear you. It's important not to frown or cry when you have a dying person. Yeah, it's hard. I know it's hard. Losing a loved one is very difficult. It's a terrible thing, but if you can, because imagine crying in front of someone that is dying. So always try to put up a face. And most importantly, when you want to discuss, talk with the person. Don't talk about the person. Because the ear is the last organ to die in the body. So you may see someone that you think is unconscious and the person cannot hear you. The person can hear you. Person may not talk, person may not react. But we are all human beings. We have souls, we have conscience, we have minds. So imagine that I'm dying and you're saying some bad things about me, some things. I mean, it's it will make me feel bad. So it's just trying to make them comfortable, then buy gifts. So here, if you have a family that can help financially, the family should help financially. Give gifts to this person as much as you can. Physical presence matters, but if you cannot be there present, give the little you have. Be there, speak to the person, smile, hold hands. It's very important to make this person comfortable while the person is dying. Then the last one, the last but not the least anyway, we have is the spiritual needs of the person. So some people, they're very religious, they go to church, they pray a lot. And if you know that this person is like that in a way, I think you shouldn't take it away from the person. So someone that is very prayerful, you can call pastors, priests to pray for the person, depending on the person's belief. Like I said, you shouldn't take it away from the person. If you know the person's life has always been like that, call the priest, receive communion. If the person requests to see maybe someone has offended him or who he offended, and he wants to see the person, if you can try as much as you can to bring the person to him or to her to see, to discuss forgiveness, reconciliation. It's very important. So you can see, for instance, someone that has been, let's say they know this person as someone that is not friendly, not nice, and suddenly the person became sick, and then and at some point he starts being nice. It changes because the person wants to reconcile. The person wants to have a calm death. Because I remember when I lost my grandmother, when I lost my grandma, and when she was ill, so I went to see her. I know she liked to knit. So and then she had her, should I say, gadgets or equipment there. So I brought it up. I wanted her to show me because she liked to teach as well. I saw that she was trying to show me, but she couldn't show me. She was excited. I saw it on her face. And she was trying to show me. She couldn't show me. Her carer at the time, who happened to be my auntie, also got some things because she's a very prayerful woman, or she was a very prayerful woman. She got something, set up an altar in her room, called priest at the time to pray for her. Her death was painful, but there is this closure you get that, oh, I did my part for this person. I did my part. I ensure this person died peacefully. In as much as we don't want the person to die, but I did my part for this person. So bringing in kindness and empathy, just make them feel loved, make them feel important, and let them die peacefully. So that you yourself, like you have peace. You don't have any regrets. Life is precious, and once life is lost, it can never be regained. So, if you have the chance and the opportunity, the time to do things for people when they are alive, do it for them. Kindness is free. I remember when I was in primary school, they always teach us the golden rule: do unto others what you want others to do unto you. I mean, I always like to direct it. I link it as I feel it's the same thing as empathy. So put yourself in people's shoes. If it was you or if it were you, would you be happy to live this way? Would you be happy when people treat you differently? So this podcast is mainly to enlighten people, developing countries in Africa who do not have free healthcare, um, that there are things you can actually do for the person. Yeah, finance, having the financial capacity, it's okay, but there are also things that you would do for someone that it's not just about money. So many people suffer and are neglected at the point of death. At least we are humans. And what we can offer is kindness at the time. Time waits for no one. That's the funny thing. Nobody wishes to die as well. But the most important thing is lead the person to a happy death. So this is the end of my podcast. um I actually hope maybe someone learned something from it, and you can ask your questions. My email address is down there. All right, so you can ask your questions and I'll answer. Um, Even on Instagram, you can decide to drop on Instagram or Facebook. Adobe Okoye is my name. Instagram, Spinky Brownie. And on Facebook, Adobe Okoye. So we can talk more. All right, thank you very much, guys. And I want to encourage you, keep listening because, like I said, this is discussion. We can talk about anything, just life, health, and balance. Keep listening, and then I know that we'll learn a lot. All right, guys. See you guys in my next podcast. Bye.